Hello, good afternoon, and welcome to Baby Child and Co. once again. It's my pleasure to come your way. It's a very special show because today we have some nice ladies who have agreed to join us to share their experiences of exclusive breastfeeding with us. Um, I'm just waiting for a few people to join us. And when you join us, kindly share to your groups, share to your friends, and tag someone. So let me also take a minute just to share to my page, and then we will proceed. If you have never met me, my name is Dr. Sarah Mori. I used to work until recently at Kolebu Teaching Hospital as a pediatrician. Um, but currently, I am working at the Red Cross Children's Hospital in Cape Town. It's just a short stint, and I'll be back to Ghana to serve my motherland. So I'm just sharing this, and then we can go on. You can also take the opportunity to share if you have just joined us. Just sharing. So what Baby Child and Co does basically is child health education. We do that mainly online through blogging. Our blog is babychildandco.com. We also have a YouTube channel where we do the same thing, talk about things that are relevant to the health of your child or children. That is what we do. And today, like I said, we are talking about exclusive breastfeeding. The reason we are talking about exclusive breastfeeding is that it is the most important intervention in child health worldwide, everywhere in the world. Whatever diseases you see, especially the infectious ones, sorry, I'm echoing. Whatever diseases you see, especially the infectious ones, most of them are prevented by exclusive breastfeeding. We have lifestyle diseases as well, diabetes, overweight, and obesity. They are all preventable by immunization. And then we have also allergies. They are all preventable by immunization. And so exclusive breastfeeding is very, 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 very important. Now I have a few people online. You can say hello to me. Hi. You can say your questions, type your questions, and I'll read them out and my guests will answer them for you. Let me start off by introducing my guest. Frema is a senior midwifery officer in Kolebu Teaching Hospital. She was a midwife when I was a house officer, so that is how long she has been working. So she's going to facilitate today's discussion. She's going to take the questions that are technical. Um, I think I will let the others introduce themselves. But before I do so, let me say a big thank you to Zinkovit, who have kindly agreed to sponsor this for us. We know that just like breastfeeding, zinc has a lot of important roles in child health as well. If you want your children to achieve the height that God made them to achieve, then we are talking about zinc. If you want their wounds to heal quickly and well, we are talking about zinc. If you want them to recover from diarrhea, we are talking about zinc. Respiratory infections, we are talking about zinc. And for you, the mother as well, if you want to be healthy to breastfeed and take care of your child, we are talking about zinc. So we'll kick off this discussion by allowing our guests to introduce themselves. Tell us how many times they have exclusively breastfed and how they found the experience. So I think I will start with Auntie Rose.
Hello, good afternoon. Okay, my name is Rose Naughty. I'm a businesswoman, and then I've done exclusive for 3 children. So I guess um, I had my first child when I was 23, and then I did exclusive for 6 months. She never had diarrhea. She never, was admitted at the hospital, and she's now 23. And I can say from then till today, she's never really been ill. She's now out of school. She completed nursing last year, December. My second one, I did exclusive for 6 months as well. She's now 13. We've not had any issue apart from tonsillitis no respiratory problems, no diarrhea, nothing. I mean, I can say I really enjoyed breastfeeding them because it was cheaper. I didn't have to go and buy baby food, and I didn't have to buy feeding bottles. After 6 months, it was a little difficult, but they adjusted quickly, especially my first one. She adjusted quickly. I mean, she ate everything. I gave her everything after 6 months. The second one was a little funny because, I mean, she enjoyed more of the breast. So she didn't want to take any other thing. So I had, I mean, quite some issues. But when she started taking other solids, she stopped breastfeeding. So she stopped on her own at, I think, 7 months and some few days. But my first one, I mean, she took it till 2 years. My third one, I gave exclusive for 6 months because she had health issues. So after 6 months, I mean, her weight wasn't going up. So we had to introduce some, I mean, SMA and then other light ones to it because she had a heart problem. So I mean, sucking the breast was a little difficult. So we had to express and then use the feeding bottle or the syringe to feed her. But still, I did the exclusive for the 6 months. And after 6 months, she started picking up. I mean, I continued to that. She was about 2 years before she passed. So I can say I mean I enjoyed the breastfeeding for 6 months, and then I mean it's one of the best experiences. You could bond with your child. I mean, you could talk to them whilst breastfeeding. You know, I try to, I mean, see the difference between the left and the right, and I realized one was a lighter than the other. So when people said, "Oh, won't your child be thirsty?" I said, "No." I realized one was food and one, that's me anyway. One was food and one was water. So I think it's the best thing any mother could do. Financially, it saves. Health wise, I mean, it saves a lot. And I'm glad I did it. I think it's about all.
Thank you so much for sharing your experiences. I've seen a couple of our friends online. Hello, giving us thumbs up. Hello, hello. We are so happy that you're here. Kindly share to your friends, your group, and tag someone as well. So, Auntie Rose has shared the experience of exclusive breastfeeding multiple children to us, with us. I know that some of you may have some questions for her. If you have a question, just put it in the chat or the comments, and we will read it out, and then we'll get someone to answer it for you. Augusta, can you tell us who you are and your experience with exclusive breastfeeding?
Okay, so my name is Augusta Kuto. Also a doctor. I'm at Kolebu Teaching Hospital. I'm learning to become a pediatrician. That is a doctor who takes care of children, like Dr. Wadri. So I have three children. The last one is currently 10 weeks old. I've breastfed the first two exclusively, and I'm currently breastfeeding the third one. She's 10 weeks old. I must say, for me, the decision to breastfeed exclusively was, well, I had the medical knowledge and I learned a lot that breastfeeding saves children, it gives them a lot of health free problems. And personally, I also realized, like Auntie Rose, I didn't have to spend extra money buying
Yeah,
formula before
yeah,
6 months. And
yeah,
I'm also someone who tells other people to breastfeed. So I didn't see why I should tell you to breastfeed for 6 months and then I go the other way. So for me, it was also a moral duty or a moral responsibility to my patients because I'll feel more comfortable trying to convince a mother to breastfeed, knowing that
yeah,
I do it myself. So, as a working mother, someone who had to leave her children at home and go to work, that was the only challenge I faced. But then I was able to plan ahead. For me, it was mainly about expressing about a month before I resumed from my maternity leave and freezing the milk.
exactly.
And that made a difference. Also, realize that if you don't have a reliable person who'll be able to handle your milk, your children are bound to fall sick. So I had
Exactly.
a very reliable nanny who I taught how to thaw the milk when you take it out of the freezer, how to put it in the cup, how to feed. So I had all those things laid out. So I could easily go back to work and work without thinking of was my baby being fed or whether baby had food at home, because I knew that I had enough breast milk to last. So that was how I went about it. Currently, with my current baby, I hope to be able to go and breastfeed her exclusively for 6 months and still continue with other foods and breast milk. So I'll leave for the rest to speak for now, but that
Okay.
has been my experience for now.
Thank you so much for sharing your experiences with us. Our wellness coach, can you introduce yourself and tell us your experience with exclusive breastfeeding?
Good afternoon. Thank you for
Hi.
inviting me. My name is Dilo Asmeni. So I have just a girl, one girl, and she's two now. My breastfeeding experience, just like everyone else, I sort of knew about the benefits of exclusive breastfeeding, and I was determined to do it. Another thing for me was I had clients who were moms, and I had coached them way before I became a mom. So I wanted to show them, I wanted to be a good example to my clients, to make them understand why they had to do it. And then for me, I'm always talking about nutrition for the mom and the benefits that can also have on the child. And I wanted to see it for myself. I wanted to see how it plays out in my own baby. So my breastfeeding experience was excellent because I'm a stay-at-home, mom
Yeah.
first and foremost, and a wellness coach who works from home. So for me, I felt I was very available and I could do everything to, feed my child, be there for my child, bond with my child. Unlike maybe the rest of the moms, I don't know. I started out day 3 in NICU. So we had our baby, came back home the same day. She was okay. Breast milk was coming right from day 1. But I also had a few challenges not knowing how long to breastfeed. I really didn't understand those basics. So I could get tired when my baby's struggling to latch and we've been at it for an hour. I'm like, I'm tired, And when we ended up in NICU, she was jaundiced. So for me, I had to learn everything in a very short space, learning how to position my baby properly so that she
Yeah.
was getting enough. I had to start, adding up with expressing breast milk and then doing it at intervals. So for me, we started taking breast from the milk and topping up with, expressed milk. It wasn't easy, the whole NICU challenge. We were in NICU for about 4 or 5 days consistently, just trying to get milk out into a bottle. Initially,
Yeah.
we started with a cup and then a spoon. So spending hours trying to give her that milk, but I was really determined not to add anything else. I wanted my baby's weight, to increase because I saw her, I gave birth to her at 3.4, and I saw her losing weight so quickly that I was alarmed during NICU. I mean, I think, Doc, you had even mentioned in one of my posts that it's normal for baby to lose some amount of weight within the first 2 weeks, I think. But after that, if they are still losing weight, there's a problem. But for me, seeing all of this happen all at the same time, being in NICU, I was really determined. So I think I was feeding so many times, bonding with her, just talking to her, looking into her eyes. The experience, I think I've mentioned, I'm someone who likes to write a lot on Facebook. I've mentioned that I would do breastfeeding over and over if given the chance because
Yeah.
it's a magical experience. Just looking into the eyes of your child and feeding them, knowing that you are nourishing their bodies and they depend on you for their food, their water, everything coming out of you. For me, the connection was beautiful, and I just love that I could spend that 6 months. I'm also a student on the side, so after 1 year I was getting really overwhelmed, and we had to stop breastfeeding at 15 months. So I mean, I enjoyed all of it, and I, like I said, I'll relive this experience again, again, and again.
Excellent. I'm so excited by the experiences that you have so generously shared with us, very personal experiences that you have shared with us. Precious Amber has come on and given us a comment, says, yeah, yeah, Auntie Augusta. I think we have some fans in the house. I've seen Genevieve Tete and someone else, Angela Sabinos, has given us a heart, and several other people have given us likes. Thank you so much. If you can kindly share, we'll be very, very grateful. And once again, we want to acknowledge Zinkovic, who is sponsoring this show for us. And we know that just like breastfeeding, Zinc has lots of things to do for your child. Just like breastfeeding, brain development, wound healing, good stature, recovery from diarrhea, respiratory illnesses. So we thank Zinkovic so much that they have agreed to do this with us. I have a few questions that I right away wanted to ask Frema to respond to some of the things you have said, but I see that she's having network challenges. So I'm just going to go on until she comes on board. She's getting frustrated. Say, Frema, if you can hear me, don't get frustrated. Take it easy. Just you will come on. Once I see you, I'll add you on. It's normal with technology. We don't control a lot
Yeah.
of things, so that's fine. We all understand. And so if you have questions for them, a lot of times we'll sit in the consulting room or we are at maternity, we are saying breastfeed, breastfeed, breastfeed. But sometimes when we say it, like Augusta said, sometimes you need to have gone through it to share your experience for it to be convincing to people. When you look people in the
Yeah.
eye, sometimes you can tell whether you have done it or you have not done it. So that is why these women have come to share their experiences. I'm extremely grateful that they have come here. So if you have any questions, kindly leave them in the comments and then let them answer it for you. One of the things that we know is that less than half of all the women in Ghana who deliver do exclusive breastfeeding. The figure is less than 50%. And that is sad
Wow.
because if you think about the amount of money that we could save, the
Yes.
impact on the environment, the impact on child health, how many times
Exactly.
to hospital because your baby is not exclusively breastfeeding.
Yeah.
We find it necessary to do this. So if you have questions, if you want to ask them about their experience, kindly feel free. They have agreed to share, and that is why they are here. I've seen that Belinda has joined us. Says hi. Hi, Belinda. How are you? All right. I'm still waiting for Frema to come. I didn't want to be the one answering or asking questions today, but you said that that is Dilo. You said that you learned about latching and so on in a very short time. So one of the things that I can say to react to that is that there are lots of resources online that could help us. So if you are wondering about the large, the position, all those things, Frema is waiting to come and teach us, show us by demonstrating. But there are lots of resources online. On my own YouTube channel, Baby Child and Co, you'll find some resources as well. So you can subscribe, and then our blog as well. There are many resources online that can teach you about those things. I mean, it's not the same as you having a baby, but it sort of helps to prepare your mind before you get there. Now, Augusta, I have a question for you. You said that if you don't have a reliable person to feed your baby expressed breast milk, your baby is likely to fall sick. Why do you say that? And if you have
Well,
any
I
experience
say
with
that
that?
I say that mainly because you know how you process the breast milk.
Yeah.
One, you express and maybe you put in the freezer. If you intend to use it after for a long period, you keep it in the freezer. Now it's not like your regular food that you take out, put it on the counter to thaw. You need to teach the person that this is something you just put in the fridge overnight, it thaws, or you put under running water, it thaws.
Yeah.
And then the containers you are going to put into, first of all, even the hand washing technique is very important,
Exactly.
because if it's someone who doesn't value hand washing or hygienic preparation of food, then you are bound to have problems with the baby falling sick. The containers you are going to pour in, how long you keep in the fridge, how long you can keep on the countertop. All those things are very important, and you need to have the knowledge or the understanding, and the person has to be on the same page with you. Other than that, you come back home and you realize that there are gaps and your baby is bound
Yeah.
to fall sick. So if you don't have someone you can entrust that responsibility too, then it becomes a huge challenge for you, the mother.
Okay. All right. We understand. Prema, you are back. Good to have you. Now, one of our guests talked
Richard,
about
you find
how.
internet fine. So, I mean, my mama,
Hi, Prema. We can hear you. We can hear you. So, can you hear us? If you can hear us, just give us a wave, and I'll go on and ask the question that I want to ask you. Prema, can you hear us? Yes. So I would like you to tell us about what resources or how you prepare pregnant women for breastfeeding when they are pregnant before they deliver. How do you go about it? Oh, I think that he's unable to hear us. I don't know whether you ladies have had any experience with being prepared for breastfeeding before you deliver. Um, Auntie Rose, did you have
Yeah.
any experience? Who spoke
Yes.
to you about breastfeeding?
Yes, I did. With my first child, I attended North Legon Hospital, Dr. Shan. So the midwife then, I mean, we used to have pregnancy class. So
Yeah.
she would, when you go, and she'll call you, sit you down, ask you, how are you planning to feed your baby? Then I didn't know about exclusive breastfeeding. So when she discussed and I got home, she said, when you give them, make sure you give the baby exclusive for 6 months. I said, what's exclusive? She said, no milk, no water, just breast. I was like, will my baby not be hungry? She said, no. So when I came back home, I discussed with my mom that the nurse said I should breastfeed for 6 months, no food, no water. So my mom was totally against it. She was like, hey, won't your child be thirsty? I gave you water. No, 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 I'm not going to accept it. I said, no, this is what the doctor said, this is what the nurse said, so I'm going to do it. She said, are you serious? I said, yes. Then I had stopped working. I decided to start my own. I was working with a travel and tourism company because I did ticketing. So I was working. And I decided to stop work and take care of my baby. So she's old enough for me to go back. So she said, are you going to have that time to breastfeed? I said, yes, I'm going to have that time. So when I did it, in fact, she was amazed because she didn't do it with us. And she was frank with me. She said, no, I didn't do it with any of you because by 3 months, you are drinking cocoa. But I did it for 6 months. And I mean, I'm glad I went to the hospital. I'm glad I met a midwife. So with my second child, I had her at the same hospital. That's not Legon Hospital. With my last one, I had it at Sam J. So they also had a pregnancy class every time. I mean, once in a month, you go, we have a class, they'll discuss with us. So I think basically I learned it from the nurse and the doctor, and I'm glad I did. And there's one thing, my baby never had diarrhea. She could constipate for like 1 week, and I get so scared. I'm like, what's happening? I'll send her to the hospital. Doctor will say it's normal. Take her back home because she's taking exclusive, so she's not having any problem. And when she poo-poos, very okay. I think is one of the best. I mean, we should talk to women to do it because otherwise, I mean, you spend money, a child will fall ill, and then you start blaming the devil.
Okay. Great. Great. All right. Prema, can you hear us? If you can hear us, can you give us a wave?
yes, now I'm okay now. I had to change location, so I'm
Okay.
fine.
Okay, all right. We are happy to have you back.
Yes.
So we were talking about how you prepare women to breastfeed before they deliver. Can you tell us about that? Pregnant women, how do you
Okay.
prepare them to breastfeed?
Okay. Thank you once again for having me. It's been pleasant seeing you all. Well, when it comes to issues of breastfeeding, we actually want to take it from prenatal and then antenatal, intranatal, and then postnatal. So sometimes you get some of the women coming to you to tell you, okay, I think I'm ready to start making babies. So then what goes into it? So then you can use the opportunity to educate the mother about everything that goes into pregnancy and then breastfeeding. and that notwithstanding exclusive breastfeeding. So that is for the prenatal mothers. Then antenatal, we have what we call the pregnancy school. Those who are not even able to join the pregnancy school, we take it upon ourselves to include exclusive breastfeeding or breastfeeding as a topic antenatally to our mothers so that even before they get to that stage, they have the information, they have the knowledge, and that whatsoever you tell them, they'll be ready to move along with you because you know information is power. If they don't have it, they are not going to do it. So this is
Yeah.
what we do along the line before the baby arrives and then even after.
Okay.
So prenatally and then antenatally we do.
Okay, that's great. So that is part of the preparation that Auntie Rose has just talked about the preparation for exclusive breastfeeding. All right, we have a comment from Belinda. She said that breastfeeding was hard for her, but she was glad she did it, but it was hard for her. Prima, can you react to that? What are the things that can make breastfeeding hard for us, and how can we make it easier for ourselves and for everybody who is concerned?
Okay,
Because
so
I
when
think
she's
this lady is not uneducated. She's very educated. She knows everything about exclusive breastfeeding. But she said it was hard for her. What can you say?
okay, so when she says it's hard for her, then I want to find out was it herself or the baby? Was there any medical indications why she couldn't breastfeed? Was it anything physiological or it was well, I don't know what she means by hard, but then let me take it from this
What
angle.
she's saying is that she breastfed, but it was very hard for her. So it wasn't for the baby, it was for her as the mother.
Okay, so does it mean she had common difficulties with breastfeeding? Let's say engorgement, mastitis, cracked nipple, or sore nipple. Was it because she was not producing enough?
Okay.
Or was there pain that was not relieved by any form of intervention?
Okay. Okay.
Okay, so
So
let's say if she had
wait.
cracked nipple,
So I was just going to say that you can take some of these difficulties one by one and tell us how we could
yes.
manage them because I believe these issues are common to a lot of women.
Okay, so before we take them one after the other, let's say cracked nipple, sore nipple, engorgement, and then mastitis. These are some of the common complaints mothers come to you with, especially when they have decided to breastfeed. So first and foremost, we're going to look at positioning and then attachment. If you fail in any of these two things I've mentioned, then that is where the difficulty may come in. So you may have your baby. So I have my baby here. Let's name him Baby John. Okay. So this is Baby John. Okay. So this is my newborn baby. And then I have decided to breastfeed Baby John. First and foremost, I should know that the baby, my positioning and attachment of this baby is very crucial. Okay. So I ensure that baby's head fall in this corner of my hand, the crook of my hand, and then the buttocks sits in my palm. And then
So if you can
the
hold on a minute, I
baby
was just trying to
is
see whether
turned
um,
towards me. So the baby's
oh, Frema is having a lot of challenges, and that
Network
is very,
challenges.
very sad. Yes. So she was
Yeah.
talking about cracked nipples. I don't know whether you women have had any experience with cracked nipples, Auntie Rose and Augusta and Dilo. Did you have any? Do you have any experience with cracked nipples?
No, no. I had engorged, but cracked no.
So, what was your
Because
experience with engorged breast?
I mean, it was so engorged. The baby couldn't suck. So I had to express for it to go down. Eventually, she was able to suck because I think my nipples are quite big. So with time, she adjusted, and then that was just it.
Yeah.
It was my
So
last child. Yeah.
yeah. Let me just say that, when you have a baby, you are learning to breastfeed the baby, as well as the baby also learning to breastfeed. So these problems
Mhm.
are very common, and they get better as you learn. Of course, it's better when you are prepared before you have the baby, but these problems are not unique. I mean, so I don't want anyone to feel, listeners to feel that, if you have this problem, it means that you cannot breastfeed, or breastfeeding was or is too hard, that you want to resort to something else.
No,
So these
it's not hard.
problems are widespread. Almost everybody
Yeah.
has had them. And one thing you said though, when the babies are born, their mouths are also very small.
Exactly.
And except for the first week to 2 weeks when they lose weight, after that they just grow very, very fast. So as
Yes.
they grow, their mouths also grow bigger, and then it
Mm-hmm.
enables them to accommodate your nipple. So there are lots of women who
Mm-hmm.
have big nipples, and then when they have babies, the babies are not able to latch on well initially, as happened to you. But I'm glad that what you did was that you expressed the milk, and with time, the baby was able to latch on, because the baby got
Yeah.
better. You also got better. And then, of course, the baby's mouth became bigger. So the baby could
Yeah.
accommodate a bigger nipple at the time. And that is exactly how you were supposed to go around it. So well done.
Yeah.
Augusta, have
Thank
you had
you.
any experience? Yeah, we are clapping for you. Augusta, have you had any experience with
So I
breast?
had almost all the problems. I had sore nipples, I
Dokita.
had engorgement. Yeah, so my my auntie used to tease me that this is practicals. This one, you've come to the field. It's not about the knowledge, because I had all the knowledge about attachment and positioning, but then
Exactly.
initially it was very difficult for me. I really struggled to even feed my baby from my left side initially, and it took a while for us to be able to get used to each other on the left arm. On the right arm, it was fine. So I had engorgement, I had mastitis. I didn't have mastitis. I had engorgement, I had sore nipples. And for the sore nipples, it was so painful. In fact, I didn't even want to breastfeed, but then you realize that the more you didn't give it to the baby, then you have engorged breast and became more painful. So my auntie encouraged me, and then with time, we were able to get used to each other, and then the sore healed, and I was fine. But then I had those challenges, even as a doctor, I had those challenges.
So, we have doctors experiencing the challenges. Today is not about me at all. So I don't want to share my experiences. Pediatricians experience the challenges, principal nursing officers, everybody, wherever you are, the challenges are not unique to anyone. Okay, I think FEMA is still struggling, and then there's a device that I'm unable to identify. I don't know if that is FEMA. Before that, I would just like to ask Dilo to answer a question that has come up for us. That is Lydia. Lydia Gagba is asking, what is the importance of exclusive breastfeeding? Now, this is not a medical question, so you don't have to go and think about all the meaningful things, but you have done exclusive breastfeeding. How do you think it benefited you? So you can talk about how it benefited you as the mother, then you can talk about how it benefited your child.
Can you hear me? It
We
looks
can
like
hear
I'm
you very
backstage on my screen. Anyway. So for me, I mean having the knowledge of breastfeeding building
just a minute. Just
immunity
a
for.
minute. There is an echo, so I don't know whether somebody is watching and also on the streaming. When that happens, then we hear the echo. So you should put the volume, if you are watching on Facebook and still on the stream, you should put the volume on Facebook low. Okay, that echo has gone now. Dilo, sorry for interrupting. Can you continue?
Okay, so having the knowledge of the
So we are having a lot of internet challenges, so I will just remove her. But we were talking about the importance of exclusive breastfeeding.
Yeah.
Like I said, there are some devices that I'm unable to identify. So, Auntie Rose, how did
Yes,
exclusive
darling.
breastfeeding benefit you as the mother?
Me.
Yes.
I think the bond with my child, and then financially, I benefited from it because I didn't have to go and buy SMA or um, none, right? And I didn't have to run to the hospital every other day because when I had my baby with somebody around the same time, and she started with SMA because she had to go to work, and her baby was every time sick. No, my sister-in-law actually. So I think I benefited a lot. My daughter never lost weight. She was always her weight was always there whenever we went for weighing, and till today, I mean, she's still plumpy. Anyway, I'm also plumpy, but I would say that she never lost weight. I had her at 3.250, and anytime we went for weighing, she was up there. The younger sister was 4.2 kg, and I mean, the weight was always going up. She never lost weight. She never had issues with her health, and she's still not had issues with her health. She's now 23, and the younger one is 13. So it benefited a lot. I mean, I had the time to bond with my child financially. I benefited, and health wise, yes, I benefited.
Thank you for sharing. And thank you,
You're
Josephine
welcome.
Azonu, Margaret Utuado, Precious, Amma, Peditina, Moni Delali, and Angela. You are giving us thumbs up, and we are very appreciative of that. You can share as well. Tag someone who has a baby or has issues breastfeeding that you know about, and then let them
Okay.
also join and benefit from us. Now, you also said the bond. But you know,
Yeah.
that bond becomes an issue sometimes when you have to leave your baby and go to work. Because once you are exclusively
Yeah.
breastfeeding, they are so attached to you a lot of times. They are
Exactly.
so breastfeed and just go away. But most of the time, they are so attached to you. And when you
It's
have to
true.
leave them and go somewhere, then it becomes a problem. So, how did you
Yeah.
manage that?
Okay. What I did was, whenever I wanted to go out, I didn't trust my mom. May her soul rest in peace, because I was always thinking she's going to give my baby water,
Give the
she's going to give my
water.
baby food. Yes. So what I did was, I would express the milk, and then I'll give it to my senior sister, who happens to believe in exclusive breastfeeding. So she'll take care of the baby. And let me say, I mean, let me be very frank. When I had her for the first 6 months, I was always available. The only place I'll go to is maybe to go and buy her diapers or maybe
Okay.
food stuff for the house. But I was
Okay.
always available. And whenever I went out, and you see, because she was exclusively fed, she slept well because she didn't have to have, maybe how do you call it, gas to become crampy and be crying. No. If I breastfeed her, she'll wake up around 4 a.m. I'll breastfeed, bath for her. When I put her to bed, she can sleep till about 9 a.m. I have to sometimes carry her and then forced to feed her, So I think it helped in a way. I had that time for her for the first 1 year. Then after 1 year, I started doing my own business. So then she had to start school, and then whenever she came back from school, she's always on the breast milk. I mean, ah, she took the breast as if it was hers. Even when I'm selling, she will come and drag the breast and then suck it. I had that time for her. Until today, she's very close to me. She doesn't see me five
Very
minutes. She's looking for
attached.
me. Mommy, where are you? Mommy, where are you? Like she'll be in school, she'll be calling me, mommy. I said, please leave me alone. You're a grown woman now. I gave birth at 23. You are 23, so leave me alone.
So
And I
that is
think
the bond, that is the kind of
yeah,
special bond that you can build
yeah, yeah,
um,
yeah.
with your child when you are exclusively
It's
breastfeeding.
true.
Yes, I'm always
Yeah,
talking about it, but I always find the phrase a mouthful, exclusively breastfeeding. Frema is back. Frema, you
exclusive.
were trying to
Hmm.
tell us or teach us how we should position our babies when we are breastfeeding. And please, if you are watching the Facebook Live and you are on, just mute the Facebook Live itself so that we don't have the echo. So, can you tell
Yeah.
us how we should position our babies and help our babies to latch onto the breast when we want to breastfeed.
Okay. So sorry for the break. So like we're saying, if this is your baby, so this is my baby, this is baby John, right? When you are ready to breastfeed, kindly remember to wash your hands and then dry them. So you pick your baby, making sure you are protecting the back of the child. So the baby comes straight into your stretched arm. I don't know whether you want to breastfeed on the left breast, then the baby comes on the left arm. So the head falls in the corner of your arm, and then the buttocks sits in your palm this way. So you get a complete alignment of the baby to your body. It makes the baby closer to you, and then the nose comes in direct direction with the nipple. So having obtained this kind of, let's say,
Can you
connection or body,
take that again? Prima, can you take that again? You talked about alignment, you talked about the nose being somewhere. Can you just say it again? Because we are unable to see all of the baby in you. I don't know whether
yeah.
if you move backwards a bit, it may help. Okay, this is now we can see all of the baby, but can you say it again so that we hear it better? That's fine, we can see. Can you just say it again? Oh, okay. So I guess we will still just have to wait until she comes. Oh, she's
This
ready
is
now.
better.
Yes,
Yeah.
now we can hear you. So you are
This is
about telling
better.
us, yes, it's better.
Okay. So can I go on?
Sure.
All right. So you get the nose coming into direct contact with the nipple, and then you put your forefingers beneath the breasts, and then you ensure that the mouth of the baby is widely opened. Then you put in the breast. Please ensure that the baby does not latch onto the nipple. The baby should latch on the areola. When we say areola, it's the black area that surrounds the nipple. That is the reservoir for the milk. The nipple is just an opening through which the milk comes through. So if the baby latches on onto the nipple, you feed the baby for, let's say, an hour. The moment you put the baby down, the baby will start crying because she's not had enough. But if they are able to latch onto the areola, the moment they start pressing or they start suckling, the nipple, the reservoir opens the pipe, that is the nipple, and then breast milk, enough of it is pumped into the baby's mouth. So when you are able to attain the position I've just described, you realize that you see more areola up on the upper lip than below, and then it's not painful, and then the baby is able to suckle well and then swallow. You don't have to hear any sound like the baby is trying to swallow some air, or the mother should not even have any form of pain. That is when you are able to properly attach and then position yourself to breastfeed that child. And I can assure you that when you are able to attain this properly, within the next 30 to 40 minutes, baby will be full, and then sometimes they may even let go of their breasts and then start sleeping, or they may even take it out of their mouth by themselves. But if this is not properly done or this position is not well achieved, the baby can be on the breast for as long as an hour. You put that child down, and then he'll start crying again. That is where we have the issues of engorgement and then cracked or sore nipples coming, because mothers are sometimes not able to properly position and then attach their babies to breast. So I don't know. So you see my baby, the back is sitting in my palm, and then the head is here. Automatically, the nose come in direct contact with the mouth. Root the mouth. That is, try to stroke the mouth with the breast and allow the baby to open widely before you put in the breast. If you try to push in the breast by itself, that is when they latch on to the nipple, and then the cracked nipple will come in, the sore nipple will come in, and then you say it's painful, so you're not going to breastfeed. That is what deters some of the mothers from practicing exclusive breastfeeding. But then if you are relaxed and then you're able to position the child well, you'll be able to breastfeed and then breastfeed comfortably. Thank you.
Okay, so we understand that very well. We have heard you loud and clear. Now you said, so if you don't get the attachment, the position right, then you have some of the problems, including cracked nipples. But well, I mean, sometimes it happens. You know, it happens. Cracked nipples happen. When they happen, what should we do?
Continue breastfeeding. It's painful, but you have to continue breastfeeding. You don't need any form of antibiotic. If it's so painful, it's only painful at the initial stages when you have put in the breast into the baby's mouth. But as they continue to suckle on the breast in a
Okay, so what she's trying to say is that even if you have sore nipples, you don't need to stop breastfeeding. But
not at all.
she's here. Continue.
You don't have to. No, you don't have to. You don't have to stop. Like I mentioned, you don't have to stop. You have to continue. So then we'll say you have to review your positioning and then attachment. So you have to check what you are not doing right. And the moment you get it right, the pain will automatically go down. And before you know it, within the next 48 to 72 hours, it will start resolving on its own, provided you are able to switch back to proper positioning and then attachment.
All right, that's great. Now, Auntie Rose said something very interesting. It's interesting because that is not what a lot of mothers see. She said when she was breastfeeding, I mean, she enjoyed it so much, and one of the reasons was that she would breastfeed and she would put her baby down, and her baby would just sleep, and sometimes she would need to rouse her baby to be able to feed the baby. This is not usual. A lot of mothers who are exclusively breastfeeding complain that their babies feed very frequently, especially when the babies are around 3 months and you know they are 3 months, they're experiencing this growth spurt and they are just eating and eating. They make that complaint. So she did something right. And I mean, I can guess what that is because that is what we teach mothers when they complain that their babies are feeding and feeding and feeding. Apart from the position and attachment, is there anything, Fremada, you can tell us that will make our exclusively breastfeeding babies not feed every hour or every 30 minutes they are feeding? I don't know if you heard me right.
Okay, so we have what we call hunger. So we have what we call hunger cues. That is why we tell mothers to practice what we call rooming in. Rooming in is trying to stay with your baby as long as you can so that you can pick some of these hunger cues. So when we say hunger cues, the baby may be sleeping for long hours, which the mother will be excited because maybe you have time to do other things. But then once in a while, when you enter the room, you realize that baby is trying to kind of put his hand or her hand in the mouth to suckle on the fingers or on the hands. Or even in their sleep, they will try opening their mouth as if they are taking something in the air. That way, or they'll be turning their head this way and that way. That should indicate to you that that child is hungry. So if you're able to pick some of these cues, then you wouldn't allow your child to sleep for that long hours before you breastfeed. Or every 30 minutes you enter the room and then you pick that child up and then you want to breastfeed because you want to practice exclusive breastfeeding. It's good when you go to toe that line because we talk about responsive breastfeeding even during the night. But then if you are able to pick some of these hunger cues, it will also help you to know when to breastfeed that child and then when to allow the child to also rest and then sleep.
So, in other words, when you are doing responsive breastfeeding, you realize that your babies are not feeding every 30 minutes. First, you need to have your position right, you need to have your attachments right, and your feeding must be responsive. In actual fact, a lot of mothers feed their breastfed babies too frequently. And there is a disadvantage to that. When you feed your babies too frequently, the problem that will happen is that your baby is not hungry and you are putting your baby to rest. So the baby is going to take what we call the fore milk because the baby will only feed maybe a minute or two. baby was not
Yeah.
hungry. A baby is going to take a lot of fore milk and then will not take the hind milk. And I mean, the thing just becomes so stressful because every 30 minutes your baby is crying. Probably it's not even because of hunger, but because you are not practicing what is called responsive feeding. You mistake every cry to be hunger because you don't know the hunger cues that Frema has talked about. So at this
Exactly.
point, Frema, I'd like you to explain to us what is fore milk and what is hind milk and how you can feed so that you avoid this problem of every 30 minutes your baby is crying and you need to pick your baby and feed. Of course, you need to know the hunger cues because it's not every cry that is hunger anyway. But can you tell us about fore milk and hind milk?
Okay, so let me just pass this comment. Some mothers think that because you have two breasts, one is water and then the other one is food. So when they feed
Yeah.
the baby on this for a while, then they're going to go to the other one, which they are or presume as food. But that is not the issue. Every breast has equal quantity of everything that has been endowed with it. So we have what we call the fore milk and then the hind milk. The fore milk is large, let's say it's great in quantity. It has more proteins, it has more fat, and then it has more of the lactose. The lactose is more in the fore milk. And then because it's large in quantity, that is why you have more water coming in. That does not make it different from the hind milk. When we talk of the hind milk, that comes in as you continue to feed. So as the baby suckles and then tries to empty the breast, that is when the hind milk comes in. But with the hind milk, the fat content is high, which gives the baby the energy to keep going. You get it? So when you are giving the breast, don't be in haste to take the baby off from here and bring the baby to the other breast. You allow the baby to cycle to realize that, or you feel that the breast is kind of empty. Breast never gets empty, but you have that feeling that my breast is kind of empty. That is when, if the baby is not full, she comes to the other side. So hind milk comes in when you have breastfed the baby long enough on one breast, then the hind milk will start flowing. And then it will give the baby the maximum fat it needs for it to be able to generate enough energy. So the breast is not differentiated. We don't have the water here and then the food here. They are all the same with
Okay.
the same constituents of ingredients or nutrients that the child needs.
Thank you so much. So, like
Thank
she was
you.
explaining, the hind milk and the fore milk, though they are not distinct, but what happens is that if your baby gets a lot of hind milk, that contains a lot of fat. So it keeps them
Okay.
fuller for a longer time. So I think what Auntie Rose did, whether she knew about it or not, was that you see, when you are patient and you have a lot of time to feed the baby, and you are feeding a hungry baby, that baby is hungry enough to empty the whole breast. That means that the baby will get a fore milk and will get a hind milk and will stay full for a longer time. But if you don't know
Okay.
the hunger cues and every 30 minutes you pick your baby and you are feeding, what will happen is that the breast will never be empty. The baby will not get the hind milk. And the baby who has not got the hind milk, I mean, will not stay full for a long time. So you put your baby down, 30 minutes, the baby is awake and crying. So that's one of the
True.
things that we can look at. Firma has unfortunately just so I think I will remove her now and then I'll add her back when I want her to ask a question. So answer a question. Okay. And there is a question here. Lydia is asking, when can you give your baby water? Firma, can you respond to that? When can you give your baby water?
We can only start that after 6 months because we are saying exclusive breastfeeding. That is devoid of food and water. Yes. We don't even want anything prelactal. We are doing exclusive. So you can only start that, my dear, after 6 months. And I tell you, you love it. So you only
Oh
give
yeah.
water after 6 months. Okay.
Another question for you, Frema. What if you are genuinely not producing milk? I'm sure you've seen this many, many times in your practice. When a mother comes to you and says, I am not producing milk, what is your counseling?
Okay, so we have medical indications why a baby will be supplemented. Okay, so if you are genuinely physiologically you've been assessed and you realize that yes, you are not being able to produce breast milk due to some hormonal challenges or some medical reasons why you are not able to produce breast milk or enough to sustain that child, then we may recommend the appropriate, the word is appropriate formula to use for that child. Wouldn't say you are genuinely not being able to produce, then we'll still force you to do breastfeeding. If we don't take care, that baby can get into hiding. So then we'll then assess baby and then give you the appropriate formula you can use for that child. So even before we do that recommendation, we want to assess you, we'll look at the breast, you may examine the breast and then try to express to see, we'll assess you to see how you position and attach that child. After going through all this and we realize that yes, you are not being able to produce enough or you are not producing at all, then we will come in with a recommended formula to be used for that child.
So I think what I am taking from what you are saying is that a mother shouldn't just decide on her own that she is genuinely not producing enough milk. Because from experience, most mothers who say they
No.
are not producing enough milk are actually producing enough milk. They have problems with attachment, they have problems with positioning,
Yeah.
and they have problems with lack of support. And then they feel that they are
Yeah.
not producing enough milk. So don't just say that you are not producing
Yeah.
enough milk. You need to talk to your midwife and then they see whether you are genuinely not producing enough milk. Because if you take 10 mothers, not 10, 100 mothers, about 99 of them will be able to breastfeed, provided they are given the
Yeah.
correct support. Now, Augusta, I want to you to share with us your experience when you were breastfeeding your baby with tummy issues. You know, how some mothers will say that their babies' tummies are aching or upset or not diarrhea. You know, I don't know if you understand me well. What is your experience with your baby's tummy issues when you were exclusively breastfeeding?
Yeah, so I noticed, especially with my first, my son, that um, most of the time, sometimes he'll feel bloated and he'll be stretching and he'll feel discomfort before he'll be able to pass a stool. So at that time, my mother was like, "Oh, let's buy gripe water." And I'm like, "Oh, Mama, gripe water, dear, I don't think will make any difference." Oh, then someone said, "Try bonus," and I'm like, "Oh, it won't make any difference." But then I did try the Bonisan, and in fact, it didn't make any difference, so we stopped. Subsequent pregnancies, I realized that it was just something with babies as they learn how to pass stools. They had like sort of like discomfort or it appeared to us. That's how we, the mothers, perceived it, that the baby has tummy upset. So the baby will be stretching, those kind of things. But then later I realized that, oh, as they grew, they stopped it. So I didn't bother with um, tummy issues with my subsequent pregnancies because I'd come to understand that as they grew up, all those things left.
Well, yeah.
There are a few questions here, but Prema has left the stream, so I'm waiting till I see her and then I just um add her back. Um, yeah. So I don't know, Dilo, what experience do you have? Oh, I just added her and she's gone again. Okay. A lot of our guests are having internet issues. All right. So I
Yeah.
just want to say hello to some of our friends again. Bernice Dobrus, Homeku, Audubu, Kari, Josephine, Precious, Amma. Thank you so much for joining, for liking, and for those of you who have commented. And we are grateful to Zinkovic for sponsoring the show. Zinc has a lot of advantages or a lot of reasons why your bodies need zinc. In fact, deficiency of zinc is so common that now, according to the World Health Organization, anybody who has diarrhea should take zinc. You know, that's how
Yeah.
important zinc is. And the mothers as well. We also need zinc to be able to care for your children because if you are not healthy, then you cannot care for your children. So they have the syrup, they have the tablets, they have it in all sorts of formulations. All right. Thank you, Zinc of it. I'm still waiting for Frema to join. Okay, I want to add on Dilo now. Dilo, what has been your experience with tummy issues for your baby that you breastfed? Oh, she has promptly disconnected. Okay, Frema, you are back. So there's a question for you. Please
Yes.
educate me on express milk, how to preserve it and its usage.
Okay. So when it comes to storage of milk, we have those who want to put it in the fridge and then within that it's used. And some people have it in excess that they want to put it in the freezer and then at the appropriate time it is brought out, stored, and then used. So if you want to keep it in the fridge should not be the one that everybody comes in to open and close, open and close. When you do that, the temperature of the milk gets disturbed. So for that one, you can keep it in for like say 3 weeks with a constant temperature. You bring it out, you thaw it, and then in a warm water you can breastfeed the baby. And then in a deep freezer, you can keep it in for 3 months. After which you can also bring it out and then use under constant temperature, not the one that will swing today the light is on, today tomorrow the light is off. It may go bad. So you have to make sure that wherever you are storing the milk has constant temperature that will not affect the the milk as you decide to feed the baby with it. Yeah.
So from experience, Augusta, what would you like to add to this? What was your experience feeding your baby express milk?
Oh, feeding my baby. I actually started feeding express breast milk from like the second month because I wanted the baby to start getting used to it. And for me, the experience it wasn't so different because by the time it wasn't so different from the baby feeding directly from the breast because for me at that time I knew that well baby could take this much and giving the baby that much I knew the baby would get full. Also with regards to the storage, I just had to dedicate a specific portion of my deep freezer to the freezer part, my fridge, and then I nobody kept anything else there. So that place was the I called it my breast milk bank. So nobody put any water there, nothing. It was just that part of the freezer. And then I had some storage bags from breast milk, which I kept it in. I labeled them and then I we just kept using the older milks first. I didn't have baby didn't the babies usually didn't have any change in their behavior compared to sucking directly from the breast. So I knew that I was covered and I knew the babies were okay. They didn't reject the milk that I had frozen and thawed for them. So I knew that there was no problem. And they were gaining weight all right as well. So I knew that everything was fine.
Okay. But when you have a mother who plans to go to work, if you know that you are returning to work at when your baby is 3 months old, you will return to work. When would you advise this mother to start expressing breast milk? That's for you, Prema.
Well, I would say the moment you realize your date of resumption. So about 3 weeks to resumption date, you can start storing, especially when they are asleep and you think what is coming out is getting wasted. You calmly or nicely express, and then you keep them in the breast milk bags, the pouches. When you get to the mother care shops, they have some of these containers for storage of breast milk. So you start from there so that you can have enough storage in the fridge. If you want to wait and start on the day of resumption, I bet you will not have enough because of anxiety. You are in a hurry to go to work. Baby is breastfeeding at the same time, want to express and leave something. You'll be at work and you'll be called that you've run out of milk. And before you get home, they would have mixed something for that child. So you start about 3 weeks to time so that you can have enough storage. And then when you are not
Okay.
in, they can support the baby
Okay.
with those ones. Yes.
There's another question for you. How can you tell when to throw away express milk? Prema, how can you tell
Yes.
when to
So
throw
when
away express?
you express breast milk. So I've given the duration at which you can keep these milks. So when you exceed any of these durations, it means that you can't use that milk. And then maybe when you bring the milk out from the freezer after thawing, the baby was not able to consume everything. Please, if it has gone into the bottle, the baby has tried sucking on it for a while, and then you are left with some amount, please discard it and then go for a new stock and use for that child, because it's not coming directly from the breast where you have a constant temperature for the milk. This one, you've brought it out from a storage area, have thawed it and tried to warm before giving. So if the baby is not able to consume within a specific time frame, let's say 30 minutes to an hour, whatever is left should be discarded. Yes.
And then I think that as you are doing it, you will get used to the smell of the milk and how it looks, right? So once the smell changes or how it looks changes, then that milk should
Changes.
be
Yes.
away. Yes, thank you so much for that. Augusta, what is your experience with constipation when you are doing exclusive breastfeeding? What is your experience? Because that's also something
Okay.
that a lot of mothers think
Yeah,
about.
challenge.
Okay, I was going to give
The
that question to Dilo and she left. She's back. Dilo, can you share experience with constipation? Did your baby
Okay,
constipate?
so yes, we had a few instances of constipation. It was more like she wasn't passing to for a number of days, and I was thankful to have a pediatrician friend. Yes, baby, I'm coming. Okay, a pediatrician friend
You
who
can hold her if you want.
usually
You
would
can carry her and talk. You can carry her and talk
a
if you want.
pediatrician friend who would always, I would consult with, and she would advise that, okay, if it's not coming within a certain number of days, and you can just try massaging. I learned how to do the tummy massages and then the bicycle, exercise for baby. It also helped relieve the gas issues for her. But I think whenever stool came out, it was never hard. So I couldn't really tell if she was constipated. But I also learned, I mean, through reading from resources that the tummy, the bowel movements, she was still learning how to master it all. And she was developing, the intestinal tract. So it's very normal sometimes to go within some days without passing through. But I also realized that when I was increasing breastfeeding and then giving express milk in between, those times I need to rest, someone else gives her breast milk. It's kept stool coming consistently. And I also knew, I mean, I had learned that within a certain period, the sort of not passing stool for some days was sort of normal, and what to expect within another set of period when she's passing stool. I should know that within a day she should do about 3 and all that. And those were coming because I had a friend who was feeding me with information. So it really helped me through the process. But yes, I don't know if it's constipation because she never really passed out hard to, but there were days when she would go without, the doing the number two, but still always came out all right. I also was constantly checking to see if I'll see phlegms, things that would maybe give notice of her having diarrhea or issues, but we never really experienced such. Maybe the green stool where parents would say, oh, it's because she's teething and all that. But I realized that green stool was pretty normal because it happened a whole lot of times. Maybe we can be educated on it if it was because of teething that stool changes. I don't know how they had their own formula, but yes, we went through periods where we were not passing stool, but whenever I came to, it looked normal according to the stool chart I had. So
All right, thank you so much. Now, Fema, what do you have to say about exclusively breastfeeding babies who go days without passing any stool? So she's having some challenges, and I'm going to remove her again. So the thing about babies not passing stools when they are exclusively breastfeeding, there are so many reasons for it. But one of the most important is that breast milk is something that the body is very good at digesting just because it is breast milk. The same thing doesn't happen with cow's milk, goat's milk, soya milk. No. Breast milk is so easily digestible. It's in a form that the body loves to take. So sometimes the body takes it and there is nothing left. Initially, the baby is learning to digest and so on. So you have quite a number of stools, frequent stools actually. Sometimes the mothers will even come and say the babies have diarrhea. They can pass stools 8 times a day, sometimes even 10. But you realize that the consistency is the same and it's not all water. But they get to an age where they are so good at absorbing the milk that nothing is left. So what you need to watch out for when your baby is not passing through is the tummy distended. Is your baby vomiting? Sometimes the tummy is distended, but it's not unusual. The baby is just full of breast milk. That's not a problem. But when the tummy is big and hard and the baby is in so much pain, the baby is vomiting, then it's a problem. But if your baby hasn't passed through for 3 days, 4 days, your baby is happy, laughing about it, then you don't have to worry about anything. That baby is not vomiting. Then you don't have to worry. Think about it like your baby is just saving diapers for you. And the green stools, yes, and the green stools. Once a while, a baby may get a green stool, and that is normal. But it is a problem when all the stools are green. In the whole day, the 4 or 5 stools your baby has passed are green and watery. The next day, the same thing. Then that is a problem. It's likely that the baby has some problem with, the gastrointestinal tract has a problem, maybe an infection or something. But an occasional green stool is not a problem. So that is nothing to worry about. Once it's not frequent, then you don't have to worry about it. That happens because sometimes the baby doesn't feed, because appetite varies during the day. Sometimes they feed well, sometimes they don't feed well. And once they don't feed well, they may get an occasional green stool, but subsequently it just goes away and you don't need to worry about it. Now, there's a question here about the duration. So I will just reiterate it because I think when Frema was speaking, her line got bad and then it was breaking. So for the duration, the listener is asking about the duration of offering express breast milk to your baby. So what happens with the express breast milk is it's in a bottle, and once you put the bottle in the baby's mouth, some digestion is happening around the teeth of the bottle. So your baby shouldn't drink that milk, leave it, and you come and take that milk 30 minutes later and feed the baby because that milk has become spoiled because the baby has partially digested it. Saliva is going into the milk and so on. So that milk is not good. Again, when you bring out the milk from the freezer and you thaw it, you should not freeze it back. Once you thaw it, your baby should finish it. Whatever is not finished, you throw it away. And then, let's say you brought out the milk, hoping that your baby will drink it, and your baby slept for long and was not able to finish it. That milk, too, don't go and put it back in the fridge. Throw it away. Now, the duration, like Augusta said, and Frema also said, when kept in the deep freezer, the milk can stay for 3 months. But you need to know which milk is 3 months old and which one is 2 months old. You can only know that when you label the breast milk with the date on which you expressed it, or label them 1, 2, 3 in order, so that you don't go and take the one that you should know. If you don't label them, you won't know which one went first, or you have a way of arranging them in the freezer. So up to 3 months, the breast milk can stay in the freezer when expressed. But if it is in a fridge, that is a different matter. If it is in the back of the fridge, it can stay maybe 3, 4, 5 days, depending on how frequently you are opening the fridge, in the back of the fridge. But if it's in the door of the fridge, it should not stay 5 days. Maybe 2 days to be on the safer side. Though there's literature that says that it can stay 3 days. But the thing is that don't keep the milk in the door of the fridge. Let it be at the back of the fridge because there the temperature is constant. So 3 days, 4 days, it can stay. If you just express the milk and you leave it on the table, that one depends on which part of the world you are in. If you are in Accra or Ghana, the temperature is quite hot. So once you keep it on the table, by 4 hours, you should think about feeding it to your baby. You should have fed it by 4 hours. So the milk that you express and it's not going to the fridge means that you are using it just around the time. but you can't keep that milk on the table from morning till evening or even from morning till afternoon. Maybe you are going out to do your hair, you express it, you can leave it on the table because you know that by 2 hours your baby will be fed and then you will come back. So those are the durations for you. In the freezer, 3 months, in the back of the fridge, 3, 4, sometimes even 5 days. In the door of the fridge, I will say don't let it go beyond two days. But when the milk is standing on the table, within 3, 4 hours, you should feed it. I hope that one is clear now because she said that when Frema was talking about it, she didn't really hear. Okay, so once again, thank you so much for joining our live stream. We wish that we could continue for a longer time. I've just seen Priscilla Michaels as well, who has joined. Thank you so much for staying on. If you have just joined us and you are watching on replay, if you have questions, still you can put it in the comments and I'll attend to them all for you. You can still share if you have just joined us because you are going to watch it all through to the end. You can share, you can put your like, you can put your heart, whatever you want to put. And most importantly, you can tag people who will watch it. They can watch it on replay, they get the whole thing again. So you can tag anybody you know. What we want to do is encourage you to exclusively breastfeed. Apart from this, we have a lot of resources that we have on our YouTube page, Baby Child and Co. So please find it and subscribe. And also like us and follow us on Facebook so that when we are doing these things, you can hear. Okay, there's one last question that I think I'll pass on to somebody before we draw the curtain, which we were just about to do. So she's saying that kindly describe how different the normal greenish stool in an exclusively breastfed baby is different from the abnormal. Augusta, what has been your experience with your exclusively breastfeeding baby who did not fall sick and greenish stools? What has been your experience?
Um, well, the greenish stools, like you said, once in a while I did notice the stools were green, but then honestly, I didn't think they were anything to take so serious because, like you said, it was just once in a while, and then baby was also fine. There was no high temperature. The baby was feeding well, so I didn't think that was a problem. I don't know if I remember the first time any of my children, like the experience from a diarrheal episode, but then for the period I was exclusively breastfeeding, I didn't think that those greenish stools were anything to take serious. I don't know if I've been able to answer the question, but then
Yes, so
I
I
didn't
think
think.
the most important thing from your statement is that you see, babies, when they are sick, you will know as a mother, you will know that your baby is sick. That your baby will not feed as well. Even though appetite varies throughout the day and maybe over a few days, appetite will vary. Maybe Monday, your baby fed very well. Tuesday didn't feed well, but Wednesday has fed very well. So those things vary, but you know your baby. When your baby is sick, you will know that there is something wrong with your baby. So when you have a baby who has passed one green stool and that baby is feeding as usual, laughing as usual, playing as usual, crawling as usual, whatever it is the baby is doing as usual. And the next stool or the next toilet is not green, you don't need to worry. An occasional green stool is okay, not a cause for concern. So if your baby has gone to toilet 3 times in a day and one is green, you don't need to worry about that. If your baby has gone to toilet 4 times a day and one is green, you don't need to worry about. So the green stool or the green toilet is a problem only when it is consistent. The whole day, all the toilet your baby passes is green. The next day, all the toilet your baby passes is green. Then it's a problem. But usually you will find that that time too, your baby is a bit not happy. Baby is not himself or herself because you know your baby. So those other things will make you know that there is a problem. Right? It's just one beans too. Your baby is happy, feeding well, laughing. Then you don't need to worry about that. I hope that I've answered that question very well. Dennis has just joined us and is saying kudos to us. All right. Oh, okay. I see what is happening. Okay. Okay. So thank you all so much for sharing with us. Thank you, Auntie Rose, though she's off. Thank you so much, Frema, who's been our resource person. Dilo is also off. Thank you so much. And thank you, Augusta. And thank you so much, Zinc COVID. So, next to breastfeeding, one of the good things you can do for your baby is to make sure that they have adequate nutrition. And zinc is one of the things. But you see, if you, the mother, you have zinc, you are well nourished in zinc, then when you breastfeed, your baby has zinc, then that baby does not need zinc supplementation unless the baby has diarrhea or unless the baby is a preterm. Those ones will need zinc supplementation. But if it's a baby who is healthy and is exclusively breastfeeding, then you will not need to supplement that. What you need as a mother is to make sure that you have enough zinc for yourself, and that is where the supplementation comes in. So thank you everybody for joining us. I introduced myself at the beginning and my guest at the beginning. I'm Dr. Sarah Modri. Dilo is a wellness coach who is a friend of Baby Child and Co. Augusta Kuto is a doctor at Kolebu Teaching Hospital, also a friend of Baby Child and Co. They have agreed to share their experiences with us. You can still keep sharing. Follow us on Facebook. We are on Facebook as Baby Child and Co. So that when we have programs, you know, and you can subscribe to our YouTube channel as well. Please do so. Not you can, you should. Thank you so much for joining us. Bye.
Bye.